about Charcot foot. Most of you probably have never heard of what this is, and we'll get right to it. And it's a deformity in the foot. So what is Charcot foot? So Charcot foot is a condition where your bones are weakened. People with diabetes normally do have this type of disease, and it also can be genetic, which is what researchers and doctors are still finding out till this day. In this picture, you can see picture A and picture B. Picture A, there's a blister shown, and from that blister, the bone is starting to bulge outside of the foot. And picture B is just an x-ray picture showing what is happening to the bone of this person's foot. Okay? So the cause of Charcot foot is a result in neuropathy, which decreases sensation and the ability to feel temperature, pain, or trauma. So people with diabetes, for example, my mom, she does have Charcot foot because of her diabetes. Patients normally don't feel when they walk, so if they walk and they bump into something, their bones can break easily without them even knowing. So they can be walking on a broken limb for 8 months, 6 months, 5 months, and during that duration of time, the bone in the second picture right here, the Charcot foot, you see how the bone on the bottom, the joint, is starting to push out just because that person broke their bone without them knowing. So you can't even feel, like I said, feel nothing, and then there's no way of telling like if their feet is warm or cold. And because of the diminished sensation, the patient may continue to walk, like I said, for the duration of time, right? So, in addition, neuropathic patients with a tight Achilles tendon have been shown to have a tendency to develop Charcot foot. Okay, let's move on. And then there are treatments for Charcot foot. Unfortunately, patients that do have Charcot foot cannot wear normal shoes like we can. So like if you're a woman that loves to go out and have fun with your girlfriends and wear like stiletto heels, unfortunately they can't wear that anymore. Or if you're a cool dude, like they say, stereotypically speaking, wearing those awesome shoes that they wear nowadays, they can't wear those shoes anymore. Why? Because the foot starts to get fatter and fatter. So there's no way for it to be narrow. Of course, there are women and men with their foot that are within. They're a bit longer on the widths, and there's shoes for them. But because of the Charcot, their foot is unfortunately way too bulgy to fit in. That's why they made orthopedic shoes for them. Now, why orthopedic shoes? They look like grandpa shoes or grandma shoes, and it sucks to wear them, but that's the only thing that they'll fit in for now until the treatments keep on going and the doctors try to recover the foot. Also, we see to the left, a crow boot. A crow boot is something that the patient wears to hold the foot together. Now, with Charcot, when you walk, you really can't walk, so you're put on a wheelchair, but when you have the ability and you're at that stage to walk, you have to have something tight to hold your foot because when you walk, your bones move. I know it sounds weird, but just as a Charcot patient, since their bones are very fragile, when they bang into something, like I said earlier, it can break again. So that's the fall point of it. Another thing is activity modification. Once you're in that stage of receiving physical therapy and other treatments, the person does have to start moving a little bit. So they suggest to go swimming, to keep their foot elevated with a bunch of pillows. And that's also to help circulate the blood in the foot going towards the whole leg. And there is a high chance for the person to get Charcots in their other foot just because they already have it here. And that's sad because it's all due to diabetes, you know? So you never know how the diabetes is gonna play into your body and where the Charcots can move. And it normally only takes place in the foot, in the joints and the tendons of the patients. Surgery is definitely needed for Charcot's foot because the bone, like I said, does bulge out, making it look like a blister. So the doctor needs to reconstruct the entire foot like a house. And I know it sounds silly, you know, they take out the whole bone and they try to reconstruct it again. And a doctor named Dr. Ronald J. Belzic has been specializing in these Charcot treatments. And I've personally seen some awesome ways in how he does things. Sometimes we take skin grafts and put it on top of the blister so the blister does not get infected, which can cause gangrene as well, and we'd have to start from square one. So things like that, small speedy recoveries will help the patient after the surgery. And there's things that get put into the foot, which are needles, plates, tools, and we're gonna go ahead and see a picture further down the line of an exfoliator that the person needs. So that, like I said, this is an exfoliator. This is step one into Charcot's foot. This is something that they need to have the first month or so to help hold the foot together. And as we can see here in the exfoliator with the doctor smiling, she's in front of the camera, there's plates coming out, there's tools coming out, and inside the foot, it's like a little house, we call it, right? Construction, because they have to rebuild the entire foot. And it is a painful process, and it does suck, but hey, we have to get somewhere to prevent this person from going back to square one. And as you can see in this x-ray, we see the tools that got put inside the foot, which are needles, maybe a long screw, maybe some plates, and sometimes there's different levels of Charcot that require way more assistance. Everyone's different, everybody is different, and it all starts by taking care of yourself. You always have to eat healthy, do weights. Unfortunately, with the person that does Charcot, they can't run, they can't walk. So what does the doctor suggest? Buy weights that are not as heavy for you to do at home. There's people that are on a wheelchair, so they can do weights at home, or when they get to that stage of going into the swimming pool, they can swim little by little. Obviously, you do need assistance to help you with that. And eating is such a great thing for you, especially with people with diabetes, with them injecting insulin into them and things like that. They can't really eat crazy things like we love to eat, junk food and stuff like that. I speak for myself. And so fruit is always a great way, and always take care of yourself. It's always important to take care of yourself. I can't imagine myself having Charcot foot. I wouldn't be able to do many things that I could do today. So thank you for your time, and thank you.